Hello friend, welcome to the channel Pharmacy Dictionary. In today's lecture video, we are going to study about drug allergy, their basic introduction and their types. So first of all, we have to know what is the meaning of drug allergy. Let me give you the example. We have used so many drugs. Have we ever faced any kind of unwanted reaction? Maybe yes or may not be yes. The yes population is only about 10% maximum and rest of 90% have never faced this kind of unwanted reaction that may be converted into an allergic reaction. So what is this actually allergic reaction? Allergic reaction or drug allergy is a phenomena which we have obtained from the administration of any kind of drug that is not suitable, that is not intended by this kind of drug, and that is not wanted at all. So any unwanted reaction which may cause different uncomfortable level in your body, either superficially or internally, either mild to severe, that we terms as a drug allergy. And there are so many other bifurcation, there are so many types or subtypes of drug allergy which we will see in this lecture video. So this lecture video might be a little bit longer than usual video, so please be with us during the completion of this topic. So first of all, we have to understand what is the drug response. See, this is the example of drug. Just it is a tablet of metformin used as a type 2 diabetes or anti-diabetic drug or oral hypoglycemic agent. So this is an important drug nowadays used by the many of the population in all over the world. So what are we expecting from this drug? So this is a drug, we are expecting its response. What is the meaning of response? Actually, I must say this is a pharmacological response. Now what is a pharmacological response? Any response given by drug is called pharmacological response. Now drug may give two types of response in broad sense. The first one is desirable and the second one is undesirable. So what is the meaning of desirable? This is a metformin tablet, and what I am expecting from this metformin? I am expecting that this drug will reduce the sugar level in my blood either by increasing the secretion of insulin or by utilizing the glucose level. There are so many mechanism of action which we are not going to study in this topic. So this is desirable action, that it will lower the blood glucose level by any mean of the mechanism. That's it. And what is undesirable action? Any action which is not intended or expected by this drug or any of the drug which you are taking. This is simply known as a unwanted or undesirable drug effect. This undesirable effect may be of different type, like side effect, toxic effect, fatal effect, lethal effect, or it may be called also known as an allergic response. So whenever the drug giving as such a response which is not suitable or is not pleasurable, which is not intended, can be converted into or can be considered as a undesirable effect. But in case of allergic response, what could be the reason? The reason could be the antigenic reaction in many of the cases, and in few of cases there may be a known reason, that is called idiosyncrasy, which we have studied in the last topic. So allergic response may be mild, and that mild may be start from itching and that can goes to the severe level, that is called anaphylaxis. Now let me clear you these two terms. What is the mild itching? Most of the cases when drugs are not suitable, they may cause some rashes, they may cause itching, they may cause rhinorrhea, they may cause redness of our skin. That is unwanted, unpleasurable, that is not severe too. In this case it is mild. So this is mild itching or mild rashes, and that may vary from this condition, and that may more severe, that may be more problematic, and that situation is known as a anaphylaxis. What is the meaning of anaphylaxis? You may visit our channels, they are uploaded the meaning of anaphylaxis too. So anaphylaxis is a sudden and more severe immunological response that may convert it into a fatal response too. Example for this anaphylaxis are so many, we will see one by one in the upcoming part, but let me give a simplest example is a bronchospasm. In case of anaphylactic, we can also termed as the anaphylactic shock, which we have uploaded in our main channel Solution Pharmacy, different types of shock also. So this anaphylactic or anaphylaxis or anaphylactic shock can be converted into a fatal response by any kind of drug. So this unwanted allergic response can be varied or can be ranged from mild itching to anaphylaxis, which may be a light threatening. Now coming to the induction types. So this allergy can induce two type of response. I can say two types of immunological response. What are these? They may induce first humoral immunological response, and the second one is cell mediated immunological response. You might be knowing about these two terms, but let me clear you with a small introduction. The humoral immunological response or humoral immunity is a type of immunity in which body fluid is responsible for the action against this kind of unwanted material. But in case of cell mediated, the activity is responsible by the cell itself. In this kind of immunological response, cell is actively participating in this immunological response. But in case body fluid are responsible like B cell and T cell, in case of cell mediated, the cell is responsible for that. We will see detailed comparison between these two in upcoming videos. So what are the basic mechanisms of this allergy? So allergy can be classified into mainly according to humoral and cell mediated, and under humoral immunity there is a type 1 allergic response, type 2 allergic response, type 3 allergic response, and in cell mediated immunological response we can include type 4 allergic response. What are these types? What are the importance? What are the basic introduction of this type? That will be a separate part. One by one we will going to study about all this part. In this video we are going to study about this introduction and type 1, that is humoral type 1 into type 1 immunogenic response. So let's start different types of allergic response and their mechanism. So these are types. This is just introduction of all this type. One by one we will see in upcoming lectures. So first type is type 1. This is also known as a anaphylactic reaction. You have to remember these two terms. The both names are very important. Type 1, type 2, type 3, type 4 are the first name, and they are also having respective names. So these names are very much important. So try to understand these two both terms. Type 1 or anaphylactic reaction are basically involved just because of the introduction of mast cell activity, and whenever there is an activation of mast cell, or I must say there is a degradation of mast cell, there is a release of histamine. As you can see in the last point, histamine is an immunological response generator, or we can say inflammatory messenger cascade reaction that started by histamine. So once there is the introduction of any kind of antigen, they may activate, like especially IgE type of, they will attach to the mast cell, they will degenerate or degranulate the mast cell, and there will be a release of histamine. That histamine may cause inflammatory response like swelling, itching, pain, and other activity. So this is a characteristic phenomena in type 1 or anaphylactic reaction. In next part we will see about details and mechanism of action and diagrammatic representation of this mast cell. So type 2 is also known as a cytolytic reaction. As name indicate, what is the meaning of cytolytic? This cytolytic word is made up of two consecutive words. The first one is cyto and the second one is lytic. That means any agent which is lysing the cyto, that means cell. This is called cytolytic, lysis of cell. In this case, there is a participation or involvement of antigen-antibody complex. As you know it very well, any agent which can activate the function or activate the activity of antibody is simply considered as an antigen. But we are not talking about the general allergy. We are talking about the drug allergy, which is induced by any type of drug which you have taken in earlier cases. So in this case of allergy, a drug will attach to any protein molecule and then they behave as an antigen. So whenever this antigen introduced to our body or intentionally or unintentionally, they may activate the antibody, or you know it very well that antibody is a bodyguard of our body, so it will try to protect your body, our body, from this kind of antigen, and there will be a reaction that is called antigen antibody reaction, and there is a complex formation, and that is known as the antigen antibody complex formation that may trigger into allergy, which is associated with the drug allergy. Now coming to the third type, that is type 3, or also known as the Arthus reaction. This is little bit important. Now let me explain about this reaction. Antigen binds to the circulating antibody. Let me take a pause. Here this antigen which a drug which bind to the protein can be act as an antigen. So now this is termed as an antigen. Actually it is a drug protein complex now behaving as an antigen. So this antigen, after taking the drug, is bind to the circulating antibody. Circulating antibody means antibody which is circulating in our body fluid. This is called circulating antibody. That is why it is written as a humoral, and type 1, type 2, type 3 are the humoral example. And humoral means body fluid. As you can correlate these two terms, that will be easy for you to remember for the longer time. Now coming to the explanation. So antibody, it is bind to circulating antigen which is bind to circulating antibody and forms a complex like the other one, but the difference is that this are binded with the circulating antibody, and this complex form deposit into the vessels of blood vessels wall, and that may cause inflammation, and that inflammation then further move here converted into a rashes, fever and vasculitis. Rashes, fever are very common with most of the allergic reaction. This start from mild itching, but the meaning of vasculitis is the inflammation of the blood vessels and the thickening of the wall of the blood vessel. That may be a severe problem, and that is caused by the type 3 or orthos reaction, which is caused by the drug which you have taken. Now coming to the next and the last sub classification of this cell mediated last classes of this mechanism, that is type 4, or it is also known as a delayed hypersensitivity reaction. Now in this subtype there are so many words are collaborated, so we should understand the meaning of each and every word, so that it will be very easy for you to get the point actually what is going to be happen in these cases. So first is say delayed. What is the meaning of delayed? Simply conversion of English to Hindi, that means der karna. Delayed means to become late, or that can be achieved after some time, that will take some time to produce any kind of infection. That's called delayed. Suppose I am speaking something which is being delivered to you after taking a 2 minute, 3 minute or 2 second, 3 second pause, that's called delayed. That is not live actually. So this delayed or not immediate actually we can say. So delayed hypersensitivity. Now another word is hypersensitive, and this word is also made of two sub words. This is the first one is hyper, that means increase in the level as compared to the normal one, and sensitivity is their sense ability to sense anything is called sensitivity. So hypersensitivity reaction means any sensitive reaction which is hyper than usual one, hyper than normal one, it will react very oftenly, very soon as compared to normal one. That's called hypersensitivity. And you know the meaning of reaction, that is action in the response of any action, then its action response, that's called reaction. That is actually response for the any action which have been given to our body. So delayed hypersensitive reaction means any reaction which take place little bit after long time, it will take some time to produce its action, like contact dermatitis in case of penicillin injection, or local anesthetic effect by the penicillin injection by the nurse or doctor to any patient. That is example of this delayed hypersensitive reaction. Let me explain few points. This is mediated by T lymphocyte. These are mediated by T lymphocyte and the macrophage. Now what is the meaning of macrophage? We will see it later in detail. Macrophage is made up of two words, macro and phage. Macro means not micro, it is a word that represents the size, that is bigger in size. Macro, big size molecules, and the phage means to phagia, is to eat. So any cells which is behaving as a macrophage must engulf the particle, that's called phagocytosis action. So any cell which is producing phagocytosis effect or phagocytic effect can be converted or termed as a macrophage. So this was a basic introduction regarding today's drug allergy. Let's move to the second whiteboard section of the same video. In that section we will discuss about the type 1 or anaphylactic reaction in much detail. So let's continue the second whiteboard section. Now in second whiteboard section we will see about the drug allergy with specific reference to type 1, or it is also known as an anaphylactic reaction or anaphylactic shock. This is one of the most important question for your main exam point of view. In your sessional exam it may chances to come in a short answer type of question. So first of all, let me explain you what are the basic process and circumstances involved in the development of anaphylactic shock. So first step in the production of this kind of anaphylactic shock is says drug induce a synthesis of IgE antibodies which are fixed to mast cell. See, in the normal case there may be chances of being allergic person with the help of some fur, some flower or some insect, but in case of drug allergy, the drug which you have been taken by yourself may be combined with the protein molecule, and that complex, that drug plus protein molecule will act as an antigen. So whenever this happens, whenever this process of formation of antigen with the drug molecules combines with the protein molecule, there is synthesis of immunoglobulin E type of antibodies, and this antibody that is formed by this kind of drug, protein, complex molecule, or simply we can say antigen, they are going to fixed on the mast cell. Now you should also know what is the meaning of this mast cell. As we have know, there are two types of hormones, we can say endocrine gland secreted hormone, exocrine gland secreted hormone. But you should know there is another type of hormone basically considered as a local hormone or autocoids. Under this category, the most important example of the cell which secrete histamine of that local hormone is mast cell. That means a cell which secrete histamine that act as a local hormone can be considered as a mast cell and few other cells too. And the responsibility of this mast cell is to secrete histamine. This main important hormones, local hormone we can say, is mast cell secreted histamine. This histamine is responsible for the development of inflammatory reaction or inflammatory cascade. That is why it is called as a inflammatory mediators, which mediate the synthesis of inflammatory response. That is why it is known as a inflammatory mediators. Now what will happen after the secretion of histamine from the mast cell, or we can say what will happen after the degranulation of mast cell? See, after the fixing to this mast cell, after binding to the mast cell, on the exposure, that is antigen antibody complex, because this is acting as an antibodies and the antigen is acting as a drug molecule, signal molecule. So this antigen antibody complex cause the degranulation of mast cell. Now what is the meaning of degranulation? That means in mast cell, or we can say inside the mast cell, histamines are present as a granules. So this is a pure and intacted granules. Whenever there is a formation of antigen antibody molecules combination, the granulation process converted into degranulation and the mast cell will start releasing the histamine. So after the degranulation of this mast cell, there is a release of inflammatory mediators like histamine. These are very important. You should know what are the inflammatory mediators like histamine, leukotriene, platelet activating factor and prostaglandin. All these are very important, and we have completed all this topic in our main channel, that is Solution Pharmacy, but that is in Hindi. So if you want to grasp this knowledge in Hindi, you may visit that main channel and link is given in the description box. But soon after coming to the next semester, we will discuss about all these parameters in English too, only in this channel. So coming to the next explanation, that is a diagrammatic representation. In this diagram, as you can see, there are so many components. Like the black circle is representing the mast cell. This is called mast cell, under which there is a formation of histamine, interleukin, platelet activating factor and prostaglandin, other many things. But these are not inside the mast cell. Inside the mast cell, there is the availability of histamine only. So what will happen? In this mast cell, there are some mast cell surface receptor. This U-like structure is representing the mast cell surface receptor. Now what is this? Anything which is acting as a receptor will simply identify the signal molecule or coming ligand molecule. So here this surface receptor will allow the binding of immunoglobulin E, which is synthesized by the drug which is interacted with the protein molecule. So after the IgE collaborate with this mast cell surface receptor, they will be occupied by different kind of antigen. Like this red dot is representing for antigen. Whenever antigen will bind with this immunoglobulin E, which is placed inside the mast cell surface receptor, this diagram you must say, this is a mast cell surface receptor in the black U shape. The green one, which is looking like Y shape, is representing for IgE, immunoglobulin E, and the red dot is representing for the antigen, which is now acting as a drug, or we can say drug is now acting as a antigen. So whenever there is a formation of such kind of cascade or such kind of series of reaction, there is a process called degranulation. What is the meaning of degranulation? Under this mast cell, there is a histamine which is available in the granules form, and this granule form is packed with the circles. Now you can see there is a degranulation, that is the releasing of granule from mast cell, and that will release ultimately this is histamine. So this histamine will be released. Now histamine is an example of inflammatory mediators. So what will it do? What will be converted into physiological action? They will start different types of signaling molecule or sign and symptom for anaphylactic reaction. And what are these reaction types or example for this anaphylactic reaction? These may convert it into bronchospasm, laryngeal edema, or third one is hypotension. Now what are the meaning of these three anaphylactic reaction? The first one is bronchospasm. That means spasm or spasm along with the constriction of bronchia, which may convert it into asthmatic attack. The second one is laryngeal edema. There is an inflammation of laryngeal part. The next one is hypotension. Hypo means low. From the normal value, there will be a reduction of that particular value. Now hypotension means reduction in your blood pressure than your normal value. That means 120/80, below that normal level mmHg. Now coming to the next explanation, what will happen after the generation of this histamine release? After generation of histamine, different types of inflammatory mediators like leukotriene, platelet activating factor and prostaglandin other, they may convert it into a fatal response, and that can lead into a death of particular person in a very quick and successive time interval. That means a very fast rapid response by this anaphylactic reaction or anaphylactic shock. Coming to the next point, allergy developed within minutes. As I told you right now, that development of allergy will be very fast, within minutes. So this is also called as, or also known as, immediate hypersensitivity reaction. As it is developing very fast immediately, that is why it's called immediate. As it is hypersensitivity more than normal sensitivity, that is called hypersensitivity reaction. Next point say, skin test may be predict this kind of reaction. If you want to predict the reaction, that is it possible to occur such kind of anaphylactic reaction with some kind of medicine, which are going to explain to the next part, then you may prefer the skin test. After applying a small quantity of the drug, you may check whether it is reactive or not for your particular person to person. It may be variable. So this can be done, or this can be predicted by different kinds of skin tests. So let me give you some examples. These are the very important, which shows the anaphylactic reaction, or I must say which may cause anaphylactic reaction in some individual. These drugs are penicillin. This is one of the most important antibiotic used nowadays, and its discovery was just a serendipity. Next one is cephalosporin. It is also example of antibiotic. Lignocaine and procaine are the example of local anesthetic, and the last one, streptomycin, is also belonging to the category of antibiotics. So these were few examples which is having potency or property to cause the anaphylactic reaction or anaphylactic shock that may convert it into a fatal response, and sometimes that patient may be die because of this reaction. So friend, this topic was general introduction regarding drug allergy and the first type of drug allergic response, that is type 1 or anaphylactic reaction. In our next video, we will see about the type 2 and type 3 respectively. So thank you very much for watching this video. If you want to take the screenshot of today's lecture, you may have it after some time. And the reference for today's topic is P. Jagdish Prasad along with Padmada Uday Kumar. So do not worry if you do not having this kind of books, or this book are you not available with yourself, you may have a screenshot of this. I have made this diagram separately from the book, though that book it will not produce you this type of diagram. That is made by Solution Pharmacy and Pharmacy Dictionary as well. So thank you again. Take care.